Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Monday, September 12th. I'm here today with Ed Brubaker, our Living Branches President and CEO, back for what's becoming our monthly edition of our COVID update.
Yeah, and I was just thinking here, it's been I think it was sometime in late February or early March when we started these in 2020. So who would have thought that 2.5 years, pushing 3 years in the not too distant future, that we'd still be doing these things. I remember those first videos where it was like, wash your hands, don't touch your nose and mouth and all those kind of things, which, by the way, are important things to remember because disease of any kind is spread, many diseases are spread that way. But we had no idea.
Nope.
We had just no idea
Nope.
what we were in for.
Nothing at all.
Which is good.
Absolutely. Well, and we're in an improving COVID situation in Living Branches right now. We have, if we're going to do our case counts, right now in Souderton Healthcare, we still have 3 residents who are testing positive. And 2 of those, I believe, will be done with their isolation period tomorrow. So we're making progress there. From a staff perspective at Souderton, we have 4 employees who are testing positive. And at Dock Woods right now, we have 2 staff persons who are testing positive, and that's it, which is a significant improvement over where we were when we were filming this video last month.
Yeah, that's right. And it still goes up and down, and the community spread rate is, as a percentage, is higher than we used to see it, but I wouldn't say they're measuring it differently. They're just not maybe capturing all the negative tests, if you will, because of how we're reporting data and how others are reporting data. But there's still a spread out there, and so it's still real and it's still out there. I also, though, heard a physician talk recently about that, the death rates are not necessarily that much higher than some other diseases that might impact people too, because there's many diseases that actually can kill people as well. And so the severity of the disease, fortunately, is much less than it was, but it's still around. And what's different than maybe like flu and pneumonia, it seems like it's tending to be a year-round disease as opposed to something that hits more in the fall. Or winter time with the flu, et cetera. So that would be one difference that becomes part of the challenge of how do you manage it and how do you best live with it, which is really what we're trying to figure out right now.
Well, and part of that, living with it, I think is going to be just like we do for the flu, yearly vaccines. And so we do now have a booster shot coming up that will be targeted at the variants that are prevalent right now. And I've had several people asking me, are we going to be doing booster clinics at Living Branches?
Yes, and we haven't fully made that decision yet, but I would say yes, we will be looking at that and doing those booster clinics again, because we do ultimately feel that the data would show that the severity and the illness is reduced because of the vaccines, and we do feel that they do work. And so we do want to encourage both staff and residents to do that.
Yeah, so stay alert for more information coming out about that, probably quite shortly. So, yeah. I've also been getting a fair number of, it's funny, my questions from residents and families kind of go in circles. And so sometimes it's up and sometimes it's down. I've been getting an increasing number of questions the last couple of weeks, and many of them are from residential living residents wanting to know, when are the guidelines going to change again? And so we just were able to, we had our coronavirus response team meeting and made a couple of changes that they're going to be quite happy with considering things along the lines of having guests over in the dining room and stuff like that.
Right.
So.
And I think you did email some of that information out there, so people can certainly check their email and get the details, and it's updated, I presume, on our website, et cetera. So yeah, we are looking at things, looking at CDC guidelines that are updated. And really, I would say the tact we're taking now is that we're looking at residential living more like community requirements and spread, et cetera. And so residential living residents, just as if they were living in the wider community, what is going on for those persons. With that said, however, we still have healthcare and personal care, and in those areas, the rules have not really changed all that much. And so, well, I should say all that much, really not at all, frankly. And so when people say, well, why are you being this way? It's because that's what the Department of Health says it needs to be, or Department of Human Services. But we do feel that we can make some of those changes and be more like CDC might recommend for the wider community within residential living. With that said, though, when persons from residential, if they were exposed or if they had COVID, they still need to keep in mind that if they're going to visit someone in personal care and health care, the rules in those areas still apply, and need to realize that depending on a person's situation, they might be more susceptible to the disease depending on their situation too. So people just need to realize that, but we're really, that's kind of the tract and trajectory we're going on. And you noted things in dining room and trying to loosen that up a bit more, and also with how we do testing, or how things are handled as far as quarantine once a person has COVID and we're positive. So there's a lot of those kind of changes that we're working on and communicating.
Well, and it's quite true, I think, that for a lot of people, we're feeling, oh, this is just the flu. This is like a cold right now. But that's not necessarily the case. I mean, we did just have someone in healthcare at Satterton pass away, and their death certificate indicates it's COVID.
Yeah, that's right. Now, the flip side is, I would say, I'm not sure that we had any on a death certificate the last 2 years that said flu or pneumonia. And those are diseases that persons in their older years do pass away from too. So we need to keep in mind that, there's still that reality of COVID, but there are other diseases too that older persons are more susceptible to as well. And so at one point, does this become more like them? When I say like them, meaning in terms of maybe the death rate or the severity of illness, not in terms of the disease being similar, because I would view COVID as being kind of in its own category. There's so many different types of symptoms that a person can have, so many different ways in which it can manifest, and then you have long COVID and a lot of other things too. So in that sense, it's kind of a strange disease, but it certainly seems like everyone in society practically is like, COVID, what COVID? And we're still definitely needing to pay attention to it, and in many ways because of the rules that we need to follow in healthcare and personal care, which I would add, hospitals aren't even subject to some of those same levels of rules and regulations.
Yeah. Well, I had a family member who was saying to me, why do we have to keep screening? It takes forever. I don't do this anywhere else I go. And I was saying to her, yeah, believe me, I know.
Yeah. And the reality is we could potentially look at that at some point. Do we screen everybody coming in, or just those that are intended to go to healthcare? It becomes, just because our buildings, how they're laid out, that becomes logistically challenging as well. But that's the reality of what we're dealing with. Yeah.
Yeah, most definitely. Well, I can't believe we always say this is going to be short, yet here we are. This one might actually be a short video. Do you have anything else you'd like to share with us?
I guess I would just observe that we're still in COVID. I mean, just before I came here, we have an ART, or Action Response Team, that they get together anytime there's an employee or resident who tests positive to say, okay, what was the exposure? What's the risk factor here? What do we need to do? Do we need to do testing? All those kinds of things. So there's a lot of those kind of things that are still needing to be addressed. And even I don't see that reality as much as I did earlier, just because of my role in the organization. But it's still here, and it's still impacting people. I wouldn't say on a daily basis, but on a regular basis. And so staff, it's never far away, I guess I would say. And so for everyone else out there who thinks it's gone, please remember our staff who need to be dealing with this when we do have a COVID positive resident or staff member. It's not gone, and we still have it that we need to deal with. So give them a compliment, perhaps, instead of a, why is this taking so long type of thing. because they really are still doing great work, and it still can be very challenging. But it's good to be at a different place, and we hope we can keep moving in this direction. But it's still out there. It still impacts us. And again, kudos to staff, to residents and families to continue to hang in there. We'll continue to work at it. We'll continue to do what we can to make life as least restrictive as possible, but while still following the rules and regulations that we're subject to. So we'll keep working at it and keep hoping for better days tomorrow. But again, appreciation to staff and to residents too for long suffering and perseverance and resilience.
Yeah. Yep. Well, thank you. Thank you to our viewers. Again, if you have questions, please feel free to email me at coronavirusquestions@livingbranches.org. And we'll see you next month. Thank you.